Hello, I am Dr. Girish Nelivigi. I am a urologist at Nelivigi Multispeciality Hospital in Bengaluru, Bengaluru. Today, I want to discuss a very important topic, bedwetting in children. A urologist encounters a lot of parents who bring their children with complaints of bedwetting. This bedwetting occurs commonly in the night time. Usual story is the parents tell that my child is 7 years old, 8 years old, but he still wets the bed. What can be done about it? Now, bedwetting occurs in about 7% of the children even when they are 7 years old. And in an adult, 2% of the people will have bedwetting, which means to say with advancing age, the bedwetting comes down, but even in an adult, the bedwetting could be there in some people. Now, what are the causes for persistent bedwetting in children? The most common reason is delayed milestones. Delayed milestones means there is a particular age at which a child develops some traits. For example, walking, talking, social contact, control of bowel, control of urine, etc. In some children, because of delayed neurological development, there is a delay in the control of urination. Therefore, they have bedwetting even when they are growing up and even when they are more than 5 years old or 7 years old. Most of the time, this is a benign condition, which means to say there is nothing to be worried about. We are not worried about a child who learns to walk late. In the same way, we don't have to be worried about a child who has bedwetting even when he is more than 5 or 6 years old. But since it's a problem which is distressing to the parents and causes a lot of social and medical problems, we have to evaluate. The evaluation is very basic by history taking, physical examination and some urine tests and maybe blood tests to see if there are any causes like infection or neurological causes which are the causes of bedwetting in children. Once these causes are ruled out, we term it primary nocturnal enuresis, which means to say a nighttime bedwetting without any cause or serious cause. What is the treatment for such bedwetting in children? One, we ask the parents to restrict the intake of fluids in the night. Second, the parents should encourage the children to pass urine before they go to bed. Third thing, they have to set an alarm wherein the child gets up at 12 in the midnight or 1 in the morning, goes to the toilet compulsorily, passes urine, comes back and sleeps so that there are no episodes of bedwetting later on. Fourth, there are some medicines which are available which are very effective. These medicines decrease the force of contraction of the urinary bladder and these are continued on a long-term basis. Gradually, the child learns to control his or her bladder so that the bedwetting eventually stops. So the parents need not worry too much about this condition. All they have to do is to seek a urologist consult and get it treated. Thank you.